Barrett's esophagus is a complication of gastroesophageal reflux disease. It is a change in the lining of the esophagus that has the potential to become cancer. In Barrett's esophagus, the normal tissue that lines the esophagus changes to a tissue that resembles the lining of the intestine. About 10% of people with chronic reflux symptoms can develop Barrett's esophagus. Barrett's esophagus has no specific symptoms, although patients with Barrett's esophagus may have symptoms related to reflux disease such as heartburn, difficulty swallowing, and regurgitation. Although the risk of esophageal cancer is higher in people with Barrett's esophagus, esophageal cancer is not common. Less than 1% of people with Barrett's esophagus develop this particular cancer every year. However, if you have been diagnosed with Barrett's esophagus, it is important to have regular evaluations of your esophagus. With a routine exam, your doctor can discover precancerous and cancerous cells early and offer treatment before it spreads. Barrett's esophagus can only be diagnosed by taking small biopsies of the esophagus, often through an endoscopy. One of the main goals of the treatment is to prevent or slow down the progression of Barrett's esophagus by controlling reflux. This is done with lifestyle changes and medication, and in some cases with anti-reflux surgery. The main risk of Barrett is the transformation of cells into precancerous lesions. The transformation process is known as dysplasia. When dysplasia is diagnosed, the affected tissue must be treated specifically to eliminate the Barrett's tissue. There are several treatment options for dysplasia. If there is a nodule, endoscopic mucosal resection, or EMR, is a procedure done endoscopically by cutting the tissue from the wall of the esophagus and removing it through the endoscope. Radiofrequency ablation, or RFA, uses high-frequency waves delivered through an endoscope to burn abnormal cells while protecting healthy cells underneath. Healthy, normal cells grow back. The goal is to eliminate precancerous or cancerous cells contained in the lining of the esophagus. These treatment options are only possible when dysplasia or cancer cells are detected early. In cases where more advanced cancer has been diagnosed, surgery to remove most of the esophagus is an option. Today, this surgery, called an esophagectomy, in our center can be performed minimally invasively. Endoscopic follow-up guidelines vary based on the patient. Our team of specialized experts will discuss with you how often you need surveillance. Typically, patients are recommended to follow up every 1 to 5 years, depending on their unique characteristics. Barrett's esophagus is caused by a combination of factors that are best managed when they are approached by a multidisciplinary team. The ideal centers for the treatment of Barrett's esophagus include surgeons, gastroenterologists, pathologists, oncologists, and nutritionists who work in an integrated fashion. In our highly specialized institute, we have a long history of multidisciplinary work that has allowed us to successfully treat this disease. The assessment of one of our specialists with a complete workup will allow us to tell the best option for you.